Does depression shrink the brain? Approximately 280 million people in the world have depression. Depression itself, among other mental disorders, account for 13% of the global disease burden. And you'll be shocked because major depression alone is expected to be the largest contributor of the global disease burden by 2030. In today's video, we will look at how depression poses a great danger to our future. Major depressive disorder, as I've said earlier, is a very common disorder that many people in our society suffer from. It is a mood disorder that can affect how someone thinks, feels, and behaves. I'm talking about the illness, not the adjective. To be more clear on this, I am going to use the Diagnostic and Statistical Manual of Mental Disorders. In the book, there are many types of depressive disorders that have been covered, but today I'm going only to look at major depressive disorder. For one to be diagnosed with MDD, there need to be 5 or more of the following symptoms within a period of 2 weeks or more. So the book divides into criteria. There is criteria A, B, C, D, and E. And on criteria A, the first symptom is having a depressed mood most of the day, every day, low interest in pleasure or almost all activities most of the day, significant weight loss or weight gain without trying, an increased appetite or decreased appetite all the time for a period of 2 weeks, lack of sleep or sleeping too much for almost every day, agitation or retardation, meaning either restless or really slowed down, fatigue and feeling tired all the time every day for 2 weeks, feeling worthless or having excessive guilt, which they may also feel guilty for being sick. Yeah, they have delusional guilt that does not make sense, lack of concentration or indecisiveness, thoughts of death, such as having a specific plan for committing suicide. The symptoms mentioned in criteria A should be causing a significant impairment in social or their work life. And then in criteria C, the symptoms should not be as a result of taking drugs or other medical conditions. For criteria D and E, they exist to only ensure that the individual is not having any other mental disorder. Now that we have covered the symptoms so that you can know how depression looks like, let's move on to the question of the day, which was, does depression shrink the brain? And this is according to a study done a while ago, and I'll have the article linked below for reference. During these kinds of studies, they use 2 ways to come up with their conclusion. First, they use imaging such as MRI and SPECT CT scans. They take brain images of a healthy person and compare the brain activity to that of a depressed person. Number 2, they look at brains of deceased people, which is called postmortem studies, where they explore the brain of a deceased person. Obviously, they don't pick anybody's brain. They only take the brains of those people who have donated for further studies. But to study a living brain, they use rats, since rats have been noted to have very similar brains as humans, at least enough to get useful information. When someone gets depressed, there's an increase in the stress hormones such as cortisol and others, norepinephrine. And when these hormones increase, cellular changes occurs to the brain cell called the neurons, causing the neurons to produce less serotonin and other brain chemicals affecting our mood. So one of the cellular changes that happens is that your brain neurons produce a protein called RED1, which is used normally in stressful situations to calm down the body. When RED1 is produced, it inhibits another protein called mTORC1, which is responsible for cell repair. But because it is blocked by the RED1, there is no repair of the damaged brain cells. And the brain shrinked cells are seen in depression is the hippocampus. The hippocampus is responsible for memory, short-term memory, long-term memory, any kind of memory. This is how depression can cause someone to have memory loss and thinking problems. Some very depressed people who go for too long without assistance may develop something called the pseudo-dementia. Pseudo-dementia is a big problem because if many people continue staying depressed, they are at a risk of the pseudo-dementia, which is not good for our society, for us to forget everything that we have been doing, forget our technology and all the big things we have been doing. So this pseudo-dementia is one of the risks that I was talking about people may be facing, and with the increase or the prediction of the increase in depression in the future, this is a problem. That's why we need to make sure people are aware of mental illnesses such as depression. There isn't a specific number of days, months, or years that pseudo-dementia starts to develop in someone, but it has been seen to be due to a cumulative effect, where somebody gets depressed and stays with it untreated depression, because there's treated depression, the people who have realized they're depressed and they have taken the right measures, such as going for therapy, they've been prescribed with antidepressants, and they're doing well. Those people who are not aware of depression or they're not treating their depression are at a risk of pseudo-dementia and other problems. But not to say there's a specific time where it develops, it's just if it goes for too long without being treated. That is why mental health promoters like me are here to educate you on the risks of mental illness and help people focus on the preventive side of medicine rather than the curative side. So antidepressants increase the production of mTORC1, which was inhibited previously, but now antidepressants increases the production of this protein. Therefore, it helps to restore the shrinked brain cell. Apart from antidepressants, there are other ways to treat depression, which is cognitive and behavioral therapy. In those kinds of therapy, people are helped to rewire the brain's perception, because in depression somebody develops delusional depression and a weird kind of thinking. So with therapy, it helps them to rewire their thinking and come back to a logic way of thinking. If you want to know how other mental disorders occurs, such as anxiety maybe, click here and keep your brain healthy.